So I changed a little bit the title. Of course, I'm going to talk about federating data for epilepsy, but because this whole workshop is about interaction between European Academy of Neurology and its different scientific panel and condition, and the Human Brain Project and eBrain, on the other hand, I wanted to give you maybe a more comprehensive picture of the very tight link that has been established between those different stakeholders. And here you have a number of acronyms. So I want to make sure that everybody understands what means HBP, MIP, and HIP as delineated on that slide. Now, indeed, whereas the Human Brain Project potentially can cover any neurological condition, from the very beginning, it has a specific interest for epilepsy and vice versa. One of the reasons is that HBP, as was presented to you yesterday, is really about creating a very ambitious digital framework for modeling brain activity and simulating it at different scale. And it suits perfectly with the complex and unique pathophysiology of the epilepsy, with anomalies from gene to behavior, and that are reflected at the different scale, microscale, mesoscale, macroscale. Now, one illustration of this that I will present in a second is the virtual brain, which is primarily a macroscale model, but which use meso and even microscale knowledge to be built. And it's being applied to epilepsy surgery already. And in this approach of building this complex model, it's quite essential to test them on what they do produce in terms of brain activity, as you can measure through EEG. And so human intracerebral EEG recording are kind of ground truths of very high value in that framework. And that's why this led to more recently develop in HBP, the human intracerebral EEG platform, which I will also mention later on. And I should also say that HBP and EpiCare, that has been presented by Ellen Cross some minutes ago, have established a specific partnership around this project and data sharing. A word about the virtual brain. It starts with acquiring MRI, DTI, performing some connectomic reconstruction. All that becomes very popular and being done in very different ways. But for the virtual brain, there is additional step. And the additional step consists in incorporating what we call a neural mass model, with the view that we can go back and forth from the model to its simulated activity, and then compare this simulated activity to what you really record in patient with EEG and intracerebral EEG, which allow to correct the model. And to be applied then in patient with epilepsy undergoing epilepsy surgery, with the view that this approach will help to better delineate the epileptogenic zone and the zone to operate. And at the moment, there is a very ambitious a randomized control trial, which is performed in France, led by the group of Marseille, Fabrice Bartholomei and Victor Gessa, that will randomize more than 400 patients to demonstrate whether or not such complex approach benefit the patient, improve outcome. The second part is the human intracerebral EEG platform. And here we already in data sharing, and data sharing for some types of data that are really scarce and of invaluable value. What can we do with intracerebral EEG, especially when study brain function and cognition? Well, it's evaluate with a unique temporal resolution how the brain activates in different regions, and you can really learn things that are different from what we have learned using functional MRI, for instance, and you can compare the two in the same patient, as illustrated on that slide. So that's basically the reason why this platform was started a little bit more than a year ago. It plans to build upon dedicated tools, most of which has been actually built over years by centers doing research on intracerebral EEG data. It aimed to be completely integrated into the eBrain platform, so to be linked to the very sophisticated atlases that are part of eBrain, but also to be related to the virtual brain and to the simulation and model that run on high-performance computer. And the view is not just to have a repository. There are already a few repositories of EEG data and intracerebral EEG data, and that's useful to share those data. But here we want to share much more than data. Protocol, new protocol, and promote new protocol and multi-strategic study, and also analytical tools. The tools to analyze those intracerebral EEG data are complex and more and more sophisticated, I will say, and there is a value of centralizing them and making them more available to everyone. And we hope it will also have some clinical impact. We are lucky that the great majority of SEG centers in Europe, in Asia, in Australia have agreed to participate to this project, which make quite a lot of center and potentially intracerebral EEG data to be collected and gathered. I don't want to go into the detail on how the platform is being built and its architecture. It's just very important to understand that it starts with what is happening in each center, and then the data are being moved, of course, on the platform in a space which is private and personal, and where you can benefit from all the advantage of the platform in terms of data curation. And only then, if you wish, you can share those data with others in a collaborative space. And there's even a further step, which is completely voluntary, where some data can become public. Now, this is one example for those of you who use a micromet system for recording EEG. Actually, it's half of the 73 SEG center that I mentioned previously who are using that system. And we already created a link and a functionality which will allow you to create your virtual HIP platform on your micromet system, where you will be able to simply drag and drop your anonymized EEG data that need to be anonymized first, and they will be copied on this folder. And this folder will then physically be really located on the platform in your private space. The platform is still in its pilot phase, so it's not something you can use right now, but I'm showing you, a few images of how it works already to perform a number of important steps, like co-registrating your electrode, intracerebral electrode, on the MRI of the patient using different pipeline. Here we use a pipeline which is well known by many of us, that has been developed by Chico Cardinale from Milano, and which is one of the most performant. And it's quite a challenge to develop those functionalities and pipeline on a platform that is shared by different end users who can have access to it at the same time and run it in parallel. But that's what it already does, using very common software like FSL or 3D Slicer, as you will see in a few seconds, and allow you to make those kind of complex reconstruction and benefit from all those advantages. So as you see, it's much more than a repository. It's important, of course, to have a common format. I mentioned one type of EEG recording system, but there are many others, and so different types of file format. The file format that will be used on the platform is called BIDS, from Brain Imaging Data Structure. It's the most used format worldwide for neuroimaging, imaging in general, but it has been also now expanded for EEG and intracerebral EEG. And so that will allow to really talk the same language between the different EEG system and EEG files. And of course, that also required that all the software that we use speak that language and are able to collaborate and interact with the so-called BEADS database. From the regulatory and ethics point of view, we will be able on HIP to manage and share and analyze data that has been collected during clinical practice and also research data. And often the two are completely combined in a patient undergoing intracerebral EEG investigation, both retrospective and prospective. And for this purpose, and especially for the prospective, we'll have two ethics framework, one which is a registry dedicated to this data, and the other one which is a cognition-related research protocol, a generic one that will enable to facilitate development of any new cognition-related project to be run in patient undergoing intracerebral EEG investigation. The data flow is a little bit complex. Of course, the intracerebral EEG data and the neuroimaging data that we need to co-registrate the electrode and know where you record from in the brain of each patient, it will go on HIP. But the clinical data that are captured in the same patient will be collected on REDCap. It can be your local REDCap, or it can be a REDCap that is centralized if you don't have one in your institution. And those data will then be moved to the medical informatic platform to be federated and enable multicentric analysis without moving those data outside of your institution. As we've been discussing from yesterday, this is a specific potential of the medical informatic platform. This REDCap, which is dedicated to patient undergoing pre-surgical evaluation and epilepsy surgery, was developed during the pilot phase of EpiCare, which was called Epilepsy, and which was focusing on epilepsy surgery at that time. Now, epilepsy surgery is one work package of EpiCare, and we have continued to further use and develop that REDCap. So we're moving to the MIP. And the MIP for epilepsy is using a data model at the moment, which completely reflect the data model that has been developed in the REDCap I just mentioned. So for the moment, what we do have in the MIP for epilepsy is dedicated to patient undergoing pre-surgical evaluation. And that's why we do have a large number of variables, more than 300. Those are the data collected in the REDCap, in the ECRF. Some of them concern the pre-surgical investigation proper. Others will, like neuropsych in that case. Other will look at different types of variables that could be of interest, including comorbidities. In that case, sleep apnea syndrome or others, which could be of interest, or seizure characteristic, especially those that could represent risk factor for cardiovascular complication during seizure. Or it could also be related to treatment and the different types of anti-seizure drug and their dosage. And through the MIP, as has been demonstrated with the other condition, we can have this facility of both looking at the descriptive statistic for the different data sets that are being collected, and we can also, of course, run analysis. At the moment, the MIP has been deployed in more than 30 hospitals in Europe for different projects, but among the different hospitals, 12 are part of ERN EpiCare, which is a good start, even though some of them, it was in the early stage of the project, and they definitely now need to be updated to fully explore its potential. The next step, which is planned, is to create a federation of 30 nodes for epilepsy. Actually, that federation has been created, but it now needs to be turned into a completely operational federation. The next step step 2 will be then to hopefully aggregate a federation that will include all centers participating to the human intracerebral EEG platform I mentioned. As Helen has pointed out, when this is very true, there is always the issue of who collect the data with which resources, especially when you have 300 variables to inform. Even though I must said, we had in the previous session stroke center, stroke unit in most European countries need to fill registry, national registry, to be certified. And so they have no other choice than filling those database. Some of them have among the same number of variables, about 300, and they manage to do it. And in fact, what happens often, they get specific resources to do it because it becomes mandatory for them to keep a label of stroke unit and stroke center. I will personally dream that we will have the same framework for epilepsy center and epilepsy unit, and I think it's feasible. Anyway, we're not yet there, and that's the reason why we need to find a realistic way of collecting and sharing data, and that's why within EpiCare there was a decision to focus in the first place on patient undergoing intracerebral EEG evaluation, because they are less numerous and possibly can inform on more research project than the other patient. And that will be the reason why we will focus on center performing intracerebral EEG recording for the next 2 steps. So in conclusion, epilepsy research can greatly benefit from HBP eBrain IT infrastructure and its different platform and functionalities. I do believe that the collaboration that we are trying to build here between EAN and its scientific panel on epilepsy, ERN EpiCare, the EBRA EpiCluster, and also HBP eBrain, it can really offer unique opportunity, both for sharing data, of course, for organizing large-scale innovating research project, also to get more research funding. The Human Intracerebral EEG platform will soon be available and hopefully will be in the capacity to leverage IEG-based research at an international scale. And the medical informatic platform is already enabled to federate clinical data from patients undergoing pre-surgical evaluation, in particular those who are undergoing those intracerebral EEG investigation. Thank you very much for your attention.